Hi, I'm Dr. Sadie Larson, clinical psychologist and member of the ISTSS Public Information and Education Committee. One of the goals of ISTSS is to disseminate knowledge to improve access to quality care for people who experience traumas. As part of that goal, our committee collaborates with people who developed or implemented the interventions highlighted in the ISTSS Child Psychological Treatment Guidelines. So today, I'd like to welcome Kate Chard, who co-authored the Cognitive Processing Therapy Manual, which was one of the psychological treatment interventions with a strong recommendation in the ISTSS guidelines. She also conducts research on evidence-based assessment and treatment for adults and adolescents. She wrote the manual on CPT for sexual abuse that will be published later this year, very exciting, and also sees adolescents in her practice. So welcome, thanks for being here.
Thanks so much for having me.
Yeah. So we have talked in the past about CPT for adults, but if you could give us just the kind of brief overview of the goals and the key components of CPT, and then we'll talk about with adolescents specifically.
Absolutely, absolutely. So CPT has been around for over 30 years, and the kind of current iteration of CPT is about allowing people to deal with and address their trauma experiences without having to go through the trauma memory unless they want to. And so giving clients that choice, because so many people fear starting therapy if they have to go into great detail. And so what we're finding in a lot of our work is that about 80% of clients, when given the choice of going into the trauma narrative and the story or not, would prefer not to. And so what CPT allows us to do is instead to look at the meaning that's been created. And so I think of CPT a lot as all of those things that your client comes to therapy saying is wrong with their life. I can't trust other people. I can't connect to others. I can't move forward. I don't have any power. I'm worthless. I'm permanently damaged. And you just hear this language and all of these emotions that are tied to it. And that's where CPT makes its home, because we really work on changing the structures in the brain. And we've got some research showing that this happens. We get this wonderful prefrontal cortex that should be logically thinking through things, but has been short circuited by the PTSD. And
Mhm.
we look at the meaning the client has inferred or made that seems rational, but at the end of the day, maybe isn't. And the CPT allows the client to objectively look at that information using some very brief practice assignments, about 10 to 15 minutes a day, either on an app or on computer or on paper, and really make sense of the world without the PTSD coloring the lens as much and giving them power back. And we use that with the process of Socratic dialogue, dating obviously back to the Stoic philosophers of really allowing yourself to really think. And I compare it to when you're struggling with something and you ask a friend if you can run something by them. And
Mhm.
that friend who's objective and who won't put their own lens on top of it, but just allows you to freely think, that is a lot of what CPT feels like, allowing you to do that and then giving you worksheets where you can do it on your own at home.
Mhm. And so, how then does that translate to working with whether it's children or adolescents? How does it look different with that population?
So we've done work with CPT in studies all the way down to 13, but I will tell you, I've taken CPT off label down to a precocious 10-year-old. And when I brought her in for an intake and I was trying to describe TF-CBT and CPT to her, and we were just chatting about what she wanted to be. And when she said, I want to be an ornithologist, and I thought, I don't even know what that is. I
It's
think you could absolutely do CPT. It's a bird doctor, by the way. Did not know that, but it is.
okay.
And so I would say that in my practice, I've got that choice window for clients in between the ages of like 10 to 13. But typically for most of my clients, like 13 on up, they'll choose to go to CPT. And so for me, CPT absolutely works as is with my younger clients. But the beauty of CPT is we also created the modified worksheets, the simplified forms, and we started those for a traumatic brain injury program we created,
Mhm.
thinking they would absolutely be needed there. Ironically, they were not needed there at all. But for clients who've got, dementia or organic brain damage, and some adolescents, even some folks that are more neurodivergent or,
Mhm.
on the autism Asperger spectrum. Many of them like the regular worksheets, but you know what? A lot of them also like the simplified forms.
Okay.
And so if
Mhm.
I'm working with an adolescent for whom it's just too much, or they
Mhm.
have so much homework going on already, I've got these simplified forms in my back pocket that have been shown to be just as effective. And
Mhm.
so for me, I find that CPT, in terms of all of its layout, its constructs, its sequencing, is all the same within adolescents. The big choice is whether we're going to use the simplified sheets. And I have to say, the biggest thing of all is I always mention to my adolescents this, because when they find out
Okay.
that they can be doing their practice literally when they're upset in a classroom, they
Mhm.
can run to the bathroom and do a sheet in the bathroom.
Mhm.
When they can be around their friends and all their friends think they're playing some video game, but they're actually doing a sheet, and they
Yeah.
can hide this, it just makes their kind of like acceptability of practice that much more. Oh, it's a legitimizing my phone,
Yeah.
right?
That makes a lot of sense. Yeah.
Mhm.
And it makes sense too that it would, one 13-year-old is not the same as another 13-year-old. So there's a lot of differences in maturity with the same age level.
Absolutely. Absolutely. And just kind of the way the brain works. And I think, a lot of people get worried about cognitive therapies because we do practice and we do worksheets, and people say they don't want to do homework. And I'm like, get the word homework out of here. Even with my adults, this is practice. And
Mhm.
truthfully, to be good at anything, don't you practice? So I lean into my teenagers, right? I talk about what do you do for hobbies? Is the one kid may play soccer, another one may knit, and another one maybe in theater. And I'm like, what do you do to put on a performance? Right? What is Taylor Swift? What is Beyonce? What Cardi B, who's touring right now?
Mhm.
What does Simone Biles do? All of these people practice. And
Practice.
to get good at anything you do for fun, right? I saw a kid last week, and he came in at 15 years old, and the big thing he's playing is a video game. And I said, how long did you have to practice before you won your
Uh-huh.
first match? And he's like,
Years.
oh, Dr. Chard, 3 weeks, 3 weeks.
Yeah.
Hey, how about you give me 15 minutes a day?
Uh-huh.
Mhm. And it's like 15 minutes on my phone, and I can do my worksheet. And I said, knowing you, 10 minutes. And he's like, that's easy. Right.
That's,
So changing the
yeah.
language, I think, a little bit, again, that fits very much with a cognitive model, but changing language allows people to feel like it's much easier and more approachable than just another parent, another adult giving me homework assignments.
Yeah, that makes sense. I
Mhm.
think that language does matter in all kinds of ways.
Mhm.
So for people who are familiar with TF-CBT, how would you say that CPT for adolescents is similar or different from that?
Well, they're very, very similar in many ways. And I think if you're trained in TF-CBT, I think you'll find a transition to becoming a CPT therapist very easy, and
Mhm.
vice versa, because the material is very similar. We're still both cognitive models. We're still based on the idea that the meaning of the trauma is what's impacting you. We're still going to be focused on, looking at core areas like safety and trust and self-esteem. I think the two biggest differences between there is that the TFCBT model still has some processing of the trauma through some sort of narrative. And it can be through a poem, through a written narrative of this whole story, through writing out a song. So there is still some version. And in CPT, of course, we have made that completely optional. And so I think for many children, teens that I work with, when they hear, okay, do I have to do some sort of retelling or not? That becomes a crux issue. So I think that absolutely is in there. The other piece is that TFCBT absolutely has that parent component where we are educating parents about some of the things that the kiddo is going through. And in CPT, that's going to be separate. You're going to have to choose to find a time, if the child and parent want that, to meet with the parent and perhaps give them some education. So when I'm training my trainees, I'll often say, you can invite the parent to come in for the first part of CPT and hear some of the structure, but then they do need to leave so you can have that private time and really be going over some of the more intimate details alone with the teenager, right? And so I think definitely the biggest piece is the parent education component that you do see in TFCBT, which is great. And not all of my teenagers have parents or guardians that are in their lives that could come in. So those that are in foster care, sometimes they have a guardian who drops them off at the door and then leaves, and they're not interested in attending any therapy. We also do CPT in the Adolescent Juvenile Justice Hall here. There's
Okay.
there's no
Hmm.
parent in the juvenile
Yeah.
justice hall,
Yeah.
and so a lot of times we just want to be able to treat the CPT within that situation.
Hmm.
Right. So those would be the biggest differences. And then in terms of practice, CPT is going to be kind of that little next level up of cognitive work. I think of TF-CBT as kind of the simpler cognitive exercises, whereas CPT is going to have very explicit worksheets that need to be done every single day, and that the client is going to have to take management over those. Right.
Hmm. Yeah. So more in between session practice.
Absolutely.
Hmm. And you started to touch on this, but any other kind of developmental considerations that you would think clinicians really need to keep in mind if they're doing CPT with adolescents?
Definitely, definitely. So I think the big ones that we kind of touched on were those that have some type of neurodiversion or autism or Asperger's spectrum. I'm not saying that they can't do full CPT. I'm just saying that sometimes the simpler worksheets can be more approachable for them. And so I always start with the regular model, but then remember that in the back of the book, also on the Guilford Press website and in the app, we do have the simplified ones. But I also want to touch on one that comes up a lot for clinicians is ADHD.
Hmm.
And people often are worried, can I do CPT with someone who's ADHD? They're going to be all over the place, they're unstructured. And I always bring back that one of the leading interventions for ADHD is CBT. And being that this is a CBT protocol, very much kind of true to Becky and CBT, it does fit really well with adolescents who are, because it gives structure. And honestly, using the CPT app with the structure of an app that can send them reminders of
Hmm.
when they need to do practice assignments or fill in their assessments, honestly brings more structure to their lives and can be incredibly helpful. But we can also do worksheets in CPT on some of those kind of core concepts from ADHD, like I'm not smart enough, I'm not good enough, I can't be good at school, I'm never going to succeed, that actually make the ADHD worse. And one of my favorite studies was when I first opened our traumatic brain injury program. And we had young adults coming into this. So typically men who are in their mid to late 20s. And many of these folks had literally been kind of signed off that they were going to have permanent post-concussive issues. And their own self-report said, you're going to have attention and concentration issues. After going through CPT, we showed statistical and clinical improvement in attention and concentration. So things that I think we just kind of say they are what they are. They're traumatic brain injury or they're ADHD, that doing a good cognitive exercise like CPT can actually improve those quite well. So that would be one of the big ones I watch out for. And then also, just thinking about some of the personality stuff, people are still in development. We've got all of these coursing hormones that change us. And, one of the nice things again about CPT is that we can use it to help them think more logically when the body and the brain aren't really wanting to be logical all the time,
Yeah.
right? We're wanting to be very emotional sometimes. And so
Hmm.
it can really help us slow that system down when all the messaging from inside is not wanting to go slow at all.
Yeah. Yeah, that makes sense. You're teaching some tools that would be helpful for PTSD and just helpful in general.
Exactly, exactly. So I think those are the ones that people bring up the most. And obviously, if a patient is very dysregulated and has a lot of issues, then leaning, as many of us in the field do, into some of the DBT techniques of distress tolerance or emotion regulation prior to starting can be helpful. But I never want to send a message that that's kind of the way we should be, because I think we're finding that delaying starting evidence-based treatments is actually worse in many cases. So it's only when a client literally cannot kind of sit still through a session without, some kind of grounding or regulation. But, if the client's that dysregulated that the whole session is lost, then obviously we'd want to lean into something else for a moment.
Yeah, makes sense. And what about differences in measuring treatment outcome for children and versus adults? Any differences that you think about there?
You know, I think that the beauty is there is a lot of energy going into looking at things like the PCL and bringing it down for adolescents, but we have other things in the meantime, right? So we do have the CAPS
Hmm.
for adolescents, which is wonderful to have the gold standard for adolescents. And then there are other measures. And I do want to encourage folks to look at the National Center for PTSD website because they do have an entire section on adolescents. So depending upon the setting that you work, you may even find that some of these are already loaded in your electronic health record, and being able to use some of the very simplified forms and not doing the full caps can be really helpful. Truthfully, I tend to still find that the PCL has been incredibly accurate compared to the caps when I use it with adolescents, and I've not had a problem. And so I look forward to the actual validation study coming out. But in my own work, when I've done both, they tend to trend exactly the same, much
Hmm.
like they do in my adult studies.
Yeah.
Yeah.
Um, and what type of training would you say is important for people who are thinking about implementing this with adolescents?
So I think obviously if you're going to be a child and adolescent therapist, you're probably going to go through some just general developmental courses, which I think are very, very important. I think also it can be really important to just understand some of the social biological concepts that go through adolescence and the changes that can occur in all of us, and being very accepting of different culture. I mean, adolescents live in a very different world than some of us adults live in, and the social media world and the demands that come from all of that, and the pressures and the harassments and the exposure to things that, I mean, I have two teenagers at home. And so I'm never, let me say, never not surprised by how much stuff they learn so early just from music and social media and friends. And so I think being really aware of some of the language and some of the hot topics so that you can lean into some of this for the practice type language. Then, obviously, getting a regular CPT training, but I would absolutely encourage going through consultation with a therapist who's a trainer who's done work with adolescents, because I think number one, it can ease some of the clinicians' anxiety about doing it themselves. But also, I think one of the things that therapists tend to do is when something is novel or new, we tend to go back to what we've always done instead of leaning into the new thing we're learning. And so I think it can be really helpful to have that clinician who's consulting with you about this is how you can stay the course in CPT, or this is how CPT can help you with making sure that you're doing the right thing for the client in the right moment with this therapy. But truthfully, I really want to dispel some anxiety on this. That in all of the studies and pilot work that I've done, having a background in child and adolescent has been great, but just staying in that model and having those simplified worksheets has been the best thing for me. Mhm.
I can imagine too. I'm more used to working with adults and oftentimes people who've had PTSD for decades. So the idea of being able to intervene much earlier makes complete sense.
Absolutely. And I think that the one fun thing I would throw out is that when I work with adolescents, one of the biggest things, of course, all of us say is the parents are the problem, right? And you don't have that when you're doing a therapy like CPT because this isn't a parent-child therapy. It's not a PCIT or anything like that. And so sometimes I find, it can be helpful to get permission from the child to talk to the parent or guardian, and create some ground rules. And so one of the things I often like to set up is that if they have other siblings in the house, that we make sure the siblings are not allowed to touch the teenager's phone or folders,
Hmm.
because the last thing you want is your little sibling reading this kind of graphic detail. But I
Yeah.
also respectfully ask that the parent not be reviewing it. How
Hmm.
can you complain about your mom or dad, bothering you if you
Yeah.
don't have the safety to do that? So in the app, we can actually lock down a separate lock code for the CPT. And so I'm like, can they have their own lock code? And I promise you, if there's a threat to harm of self or other, I will call immediately. But
Yeah.
you do have rights to their file, but can we respectfully not look at their practice
Hmm.
and allow that to be private? But the other fun one that I've dealt with is that adolescents are still adolescents. And so often parents want me to create these perfect little children who aren't emotional or angry or sullen or
Hmm.
moody or anything. And I have to really normalize, I can treat the trauma response, but you still have an adolescent.
Yeah.
And I can't promise they're not going to annoy you. And I've had probably in my career at least 10 phone calls from parents saying, I think they're broken again. I think they're not well. I think they're just
Yeah.
all this language of
Mhm.
they're the problem. And I'm like, describe to me what they're doing. And I'm happy to get them in here and talk one more
Mhm.
time. But I think you've got an
Yeah.
atlas. And then
Very
I
good
think
point.
suggesting a little parent training on how to parent an adolescent isn't a bad thing,
Yeah.
right?
Yes.
So
Yeah. Yeah. Well, that would always be the different nuances working with a parent, even if they're not in the therapy, but they're still going to have a big influence on how the adolescent is doing and vice versa. So, still, how do you help kind of set them up for success?
absolutely, absolutely. And I've actually brought a few parents in and had them see somebody else in my clinic when we realized that sometimes the parents have trauma histories of their own or
Mhm.
other issues going on. And teaching a parent a good ABC worksheet that they can do on their own can often calm a lot of this down.
Yeah.
So.
Well, wrapping up, I guess I just want to ask any other kind of lessons that you've learned from using this treatment with adolescents or advice that you would give to agencies or clinicians thinking about implementing this treatment.
I think for many folks, especially dealing with our younger adolescents, I think they're so worried about the homework commitment and the burden that this is going to put on someone and the cognitive abilities. And so I think just reminding ourselves that this is only a few minutes of practice. Really, it shouldn't be more than about 10 to 15 minutes a day, and 5 to 7 days a week. If they're going to take a day off because they've got a tournament in something, let them. That's not a big deal. So really, I think kind of right sizing and normalizing instead of getting so worried that adolescents can't handle more homework. It's not, it's practice, right? And putting it on the phone makes it so much more viable to use on a daily basis. And I think the other thing is realizing that although the concepts may seem new to you as a therapist and like, oh, these are hard to read, we did create this at an eighth grade reading level.
Mhm.
And with the simplified worksheets, they come down much further from there. And with our research showing that we can use this with an illiterate population, you also have worksheets that can be memorized and just dictated into. So, perhaps trying it a couple of times before you think, oh, I don't know that this is going to work, because I think anything that's new often feels daunting for any therapist. But I think once we actually get into it, teenagers like this. And one of the things they like the most is it's very logical. And
Mhm.
in a very illogical world where they're trying to make sense of right and wrong and fairness and figure all of that out with people who aren't always following the rules in their world, CPT lends a really calming lens for a lot of the teenagers that they find very helpful and very thankful. And the main comment I tend to hear after a teenager leaves me is, this allows me to feel like I've got control in a world that I don't have a lot of control in. And that's a nice kind of sense of purpose and a sense of I've got something to fall back on, right?
Yeah, that's a great way of putting it.
Mhm.
Um, well, thank you so much for taking the time to talk with me about this. Fascinating to just hear how this might be just a little bit different, and also that you might be pleasantly surprised at how well people take to it between 13 and 18. So
Exactly.
thank you
Thank
so
you.
much.
Oh, you're very welcome. Thank you. And if anyone ever has questions, feel free to reach out to me. I'm pretty easy to find on the internet. Okay.
Right. Take care.
You too.